Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos, and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page, and the link will be given in the description. Hello. Before I begin today's topic, I must say that I am really sorry for not being able to upload videos for last 1 month because of my health issues and certain personal issues. But I hope from now on I will be able to upload videos more frequently. Today we are going to talk about non-steroidal contraception pill and post-coital contraception. These two are two different topics, but they are very important for exam purposes because often they are asked as a part of long question or even given as short notes. And also these are important for viva examination. Previously we discussed different hormonal preparations like oral contraceptive pills, then injectables, etc. Today we are going to talk about non-steroidal oral contraceptive pills as well as post-coital contraception. So non-steroidal oral contraceptive pill, which is available in the market in the name of CHHAYA, and previously it was also available in the name of Shoheli. It contains centroman, and the chemical name of these pills is ormeloxifene. This is known as weekly pill because of the dosage. What is the dose? For the first 3 months, it has to be taken bi-weekly. That means 2 times a week, maybe with a gap of 3 days or 4 days. And from the 4th month onwards, it has to be taken once weekly, irrespective of the status of menstruation till the woman needs protection from pregnancy. So that is the dose. The question is when to start. It can be initiated at any time during menstrual cycle if it is reasonably certain that the woman is not pregnant. So we have to be sure the woman is not pregnant. In that case, we can start any time during the menstrual cycle. The following timing of initiation can be opted by the woman to start the package after proper screening by the healthcare provider. So the healthcare provider first confirms that she is not pregnant, the woman is not pregnant, and then this can be started. And the preferred timing of initiation for this medication is usually on the first day of period or on the day of abortion itself. So if it is a case of abortion, when the woman has to undergo abortion, then she can start from that day also, or within 4 weeks of childbirth. It does not matter whether the baby or the newborn is breastfeeding or not. So these are the three different situations when it is preferred to start the medication. So this is all about non-steroidal oral contraceptive pill. If asked, we have to tell what is the composition, what are the name in which this preparation is available, and also the dose, how it is given and when it is ideal to start. Next, we are going to talk about post-coital contraception. But before we go into that, we must understand what is emergency contraception. So it is a method of contraception used as an emergency procedure before menstruation is missed to prevent pregnancy following unprotected intercourse or expected failure of contraception. So what happens? Sometimes the couple or in any situation there is unprotected sexual intercourse, and maybe the male person has ejaculated inside the vaginal cavity. So there is a chance of fertilization and further pregnancy. Also, sometimes what can happen is the couple may have used some kind of barrier protection like condoms or anything else, but there may be failure of that contraceptive method, and because of that there is a possibility that pregnancy can occur. So in these kind of situations, if we need to prevent the pregnancy, we have to look for the options under the heading of emergency contraception. So what are the different emergency contraceptions which are available? Okay, we have to remember this emergency contraception is a backup plan and it should not be used as an ongoing method of contraception because there is relatively high failure rate and also high incidence of irregular bleeding. What are the different characteristics of emergency contraception? It is a one-time procedure and not a routine approach to contraception. It is used post-coital, so only after unprotected sexual act, or in case of failure of contraception after the sexual act, the emergency contraception is used. It is not to be used before the sexual act. The objective is to prevent the pregnancy. And widespread use of emergency contraception can reduce abortions, because a lot of these pregnancies are unwanted, so the woman may have to opt for abortions. And in a country like India and any developing country, abortions are most often done in the unhygienic setups, in non-medical setups by non-medical persons, which are unsafe abortions leading to lots of maternal death. So these unsafe abortions can also be avoided if emergency contraception is available everywhere and to everyone. We have to remember that emergency contraception does not dislodge an established pregnancy. So if the woman is already pregnant, it will not prevent the pregnancy any further, because she is already pregnant, and it will not even cause any abortion. They do not affect the fetal development. So if the woman takes emergency contraception by mistake while she is already pregnant, there is no evidence that it can lead to fetal abnormalities, and also there is no evidence that repeated use of these drugs can lead to ectopic pregnancies. There are two methods available. One is intrauterine device insertion, and there is hormonal methods. Intrauterine device, it is the simplest technique, and we have to insert the intrauterine device if acceptable, especially copper device, within 5 days of the sexual intercourse. We have to remember that if there is any absolute or relative contraindication, especially the absolute contraindication for IUD insertion, in that case IUD cannot be inserted. So if there is no contraindication and it is an acceptable situation, only then within the 5 days of sexual intercourse, which is unprotected, or maybe there is any contraception failure, we can insert the IUD, and it is preferred to use a copper device. IUD is preferred in women who desire to continue IUD as ongoing method of contraception. So if a woman is motivated to continue IUD in future also as a method of contraception, then it is always better to opt for the IUD as emergency contraception as well. What about hormonal? There are certain regimens available which are more or less effective. So let us look at the regimen. First regimen says 1 tablet of 0.75 milligram levonorgestrel within 72 hours of unprotected sex, and the second tablet after 12 hours of the first dose. So here only one drug is being used, that is levonorgestrel, which is a progesterone, right? 0.75 milligram first dose to be taken as early as possible, but it has to be taken within 72 hours, that means 3 days of the unprotected sex, and the second tablet has to be taken 12 hours after the first dose. Okay, that is the first regimen. The second regimen says 2 oral contraceptive pills containing 50 microgram of ethinyl estradiol, which is basically estrogen, within 72 hours after intercourse, the same dose after 12 hours. So here 4 tablets are to be taken. 2 tablets each containing 50 microgram of ethinyl estradiol to be taken as early as possible and ideally within 72 hours, and the second dose has to be repeated after 12 hours. That means after 12 hours 2 more pills are to be taken. This is the second regimen. In the first we used only progesterone, here we used only estrogen. And there is another regimen, 4 oral contraceptive pills containing 30 to 35 microgram of ethinyl estradiol within 72 hours and 4 tablets after 12 hours. So here we are taking 4 tablets of ethinyl estradiol, same as the second regimen, but we are taking 4 instead of 2. And here we are taking lower dose, that is 30 to 35 microgram. Same, it has to be taken as early as possible and absolutely within 72 hours after the sexual intercourse, and then after 12 hours again 4 tablets had to be repeated. And there is another regimen where mifepristone can be used 10 milligram only once within 72 hours after the sexual intercourse. So these are the 4 regimen which are available. Levonorgestrel, which is basically synthetic progesterone, or we have ethinyl estradiol, which is a synthetic estrogen. We can take 2 tablets and then repeat after 12 hours, or we can take 4 tablets of lower dose and repeat after 12 hours. Or alternatively, we can take mifepristone 10 milligram only once within 72 hours. So these are the different regimen of emergency contraception. We have to remember, we will often come across women who will say that they had some unprotected sexual act, or maybe they use something but there may be a failure. In that case, what they will be doing, they need to do. Even people we know can ask us these things, so we need to know the answers. What is the thing that we must advise them so that the pregnancy can be avoided? So we have to tell them about these regimens. Either use any of this regimen and that will be adequate, and also you have to tell them to follow up with a gynecologist and obstetrician. So with this, we complete today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends from other colleges. We also have a Facebook page that you can follow. The link is given in the description. Take care and we shall see you in our next video.